my name is Maria Alberty, and I am very happy to be here this afternoon and to be given the opportunity to speak here today. And I'm going to present some preliminary results of one of our studies that we conduct at the International FAST Center at the Swiss Paraplegic Center. So before I start into the topic, I would like to introduce you why it is important to do research about electrical stimulation in people with chronic spinal cord injury. Actually, people with spinal cord injury encounter a lot of pressure injuries, so 1 out of 3 people has this case. So looking at the statistics of the Swiss Paraplegic Center, there were 551 cases of pressure injuries between 2020 and 2021. And 108 were in primary rehabilitation. 143 people were having a lower motor neuron lesion, so a flaccid paralysis. 257 were having a upper motor neuron lesion, and 43 did not have spinal cord injury. However, if we look at the lifetime of a person with spinal cord injury, we see that a lot of people with lower motor neuron lesion have more frequently a pressure injury. Over the years, there have been more than 200 risk factors identified for developing a pressure injury, one of which would be age. So we have spinal cord injury, but also the age-related denervation of the muscle. We have the time since injury, and also weight plays a role, and education. So a study has shown, or it has been known, that the therapy costs for treating pressure injury largely exceed the prevention. So there is a big need to develop treatment options and to promote this. And I think a very good example is the RISE project that has been conducted at the beginning of the 2000s, showing that 1 year of electrical stimulation has a great impact on the increase in cross-sectional area of the muscle. So we wanted to identify what happens within the 6 months after electrical stimulation in people with a chronic spinal cord injury. So in the very acute stage after starting electrical stimulation. And this brings me to our hypothesis, which we expect a decrease in adipose tissue and an increase in muscle tissue thicknesses that can be observed after 6 months of direct muscle stimulation of the denervated gluteal muscles in people with chronic spinal cord injury. And this is just the number of the trial that these results come from. So this is our study design. We have 3 measurement points. So we do a measurement at baseline, 1 after 3 months, and 1 after 6 months. At each of these appointments, there are MRIs done, so magnetic resonance imaging. There is a pressure distribution measure done in sitting, so the people are sitting in the wheelchair, and a quality of life questionnaire is filled out. Then, after the first appointment, they are given the stimulation device back home to conduct home-based electrical stimulation 5 times a week. And we conduct weekly interviews to ask them how they are proceeding and if there were any issues with fixation of the sponges or with pain, for instance. Yeah, for the stimulation, we are using the stimulator Den2X, and we stimulate the gluteal musculature, as I mentioned. And for the position of the sponges, we chose a horizontal position, so actually the patients are lying prone with the sponges placed one on each buttocks, so that their electrical field is produced all over the buttocks in a horizontal way. And we did not use the safety electrodes that are shown on this picture, but we used electrodes that are put into sponges and then fixed with a belt onto the buttocks. For the electrical stimulation parameters, we did a 3-minute warm-up phase, as we call it, at 0.86 hertz. So twitch contractions with an impulse duration of 150 milliseconds and impulse breaks of 1 second, and we used 11-second bursts at 90 milliamps. This was then followed by the training. So we did 30 minutes of training stimulation at 20 hertz frequency and an impulse duration of 40 milliseconds and a 10-second impulse break. And here we used 2-second bursts at 120 milliamps. For the magnetic resonance imaging, we chose to measure muscle and adipose tissue thicknesses at different levels. So we took bony landmarks that the responsible radiologist could easily reproduce and measured always at the same height. So we chose the sacroiliac joint and then the acetabulum height and the height of the coccyx. So here you can see in the transverse plane these 3 areas. This is the same just in the sagittal plane. And for the results, we have 5 participants included in these preliminary results, 4 of which were having a complete spinal cord injury, 1 was incomplete. And as you can see, the time after injury were 23, 2, 32, 27, and 20 years after spinal cord injury. So all of them were chronic, if not to say very chronically or long after spinal cord injury. And they all presented denervated gluteal and so denervation in the gluteal muscles and in the hamstrings. This was a criteria to be included in the study. And first of all, I want to draw your attention to the left-hand side graph, which shows the results for muscular tissue thicknesses. And I see it's very small. So if you just focus on the dark blue, that's the change between baseline and the 6 months measurements. So at the height of the sacroiliac joint and the acetabulum, we can see that there is an increase in muscle tissue thickness over the period of 6 months. If we go to the right-hand side graph, there is a decrease, if you look at the dark green, a decrease in adipose tissue thickness in these same areas. However, if we look at the height of the coccyx, we barely see any change in muscle tissue thickness, but we see a large increase in adipose tissue thickness. So, what can we say? There is a change in tissue thicknesses that are already observed after only 6 months of electrical stimulation. However, the results that we see were very heterogeneous, so before we make any assumptions about this, we want to wait until we have completed our analyses or inclusion of all 20 participants on this study to do proper assumptions. Conclusively, I can tell you that the quality of life of the participants that have participated so far are largely increased. They claim that they have improved sitting posture and stability, and that is also what we see as clinicians. They have decreased levels in pain, and they say that they're less scared to acquire another skin injury. So we think this is clinically very, very relevant, and we recommend to start early, actually, after spinal cord injury, and I'm going to show you in a minute why it is so crucial. And with this stimulation, of course, we can diminish the healthcare costs and the hospital stays. So what I was saying is that here we included one participant who was just 1 year after spinal cord injury. And if we look at the changes in muscle tissue thicknesses, it is very impressive. This is a bit larger. So on the left-hand side, we have the muscle tissue, how it was at the beginning. So actually here is the muscle thickness or the muscle tissue that is left. And after just 3 months of electrical stimulation, we acquired a thickness that is much, much larger. So it goes a lot quicker if you haven't been as far in the denervation process. And for future ideas, I just want to say that we are planning to implement some fiber tracking measurements in our future analyses. And we have just made some tryouts with this, actually, but it seems feasible in spinal cord injury. And it allows us actually to determine a factor that is called fractional anisotropy factor, and that allows you to determine the fiber density in other muscle fibers. So last but not least, I would like to thank my team, especially Ines, who is here, and Katrin, Suse, and Ursula at the Swiss Paraplegic Center. I would like to thank Ugo Carraro for the organization and our participants as well. Thank you.
Questions?
If you want.
Okay.
Thank you, that was great. What sort of pain did the patients feel relieved of?
So most of the cases were back pain, so that they feel like, just a compression in the lower back, and that was relieved, but also pain in the hip flexors that get very tight. And so since they had to lie in a prone position every single day, they had massive stretches on there, so that was pain relieving.
Mm-hmm.
Yeah.
And did you notice any change in the movement caused by the stimulation over the 6 months?
In the movement?
In contraction, do the muscles visibly contract?
Yes, so we did see in some participants that they had a contraction, so we had visible contractions at the beginning of simulation, and for some they only appeared after a while because you're just progressively building up these muscles again. So in a lot of cases, especially these very chronic ones, you don't see the big contractions yet. Yeah.
Sorry.
As another indication of progress.
That's true. Yeah. Good point. Thank you.
Only one question. Did you increase the stimulation amplitude over the time course of training, or did it remain only 120 milliamps all the time for the 6 months?
Mm-hmm. So in the ones that could tolerate it or actually did not feel that the stimulation was that strong, we immediately went up to 90 milliamps or 120 milliamps respectively. For others, so the incomplete one, for instance, we had to start with lower amplitudes, and we always told them to build it up to the 90 milliamps, because it is known that you need a specific intensity to actually see increase in muscle thickness.